Sure. My name is Matt Walker. I'm with the Independent Pharmacy Association and the West Virginia Primary Care Association.
Thanks for coming, Matt. If you'd just like to raise your right hand, you swear the testimony you're going to give is the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Thanks for coming. You can maybe give you a minute to give your spiel, and then we'll open it up for questions.
Sure. Thank you, Mr. Chairman. Thank you, Senators. I represent around 200 pharmacies, several different types, FQHC pharmacies, which are almost all 340B covered entities, as well as about 60 independent pharmacies, which are just locally owned pharmacies throughout West Virginia. Over the years, I think my members have felt a great need for transparency and oversight for PBMs. I think that sentiment shared all across the country. I think you're seeing states, one after another, doing some sort of oversight, licensure, some type of regulation of PBMs, because this industry is so important to all of us. You know, pharmacy spending, whether you're looking at Medicare, Medicaid, PEIA, commercial insurance, it's usually one of, if not the largest spend items of any health plan. So if there were ever an item, I think, that needs transparency, regulation, oversight, it is this item, especially as we've watched drug prices skyrocket over the years. We do support every piece of this bill. I think the licensure piece goes hand in hand with all of the other pieces of the bill, in that it is essential in carrying those out. And what I mean by that is, if we have mandates in code or language, what is the real remedy? Who do we speak to enforce these pieces of code if we have a problem, as you pointed out? And there was one distinction I wanted to make about the registration and the difference between registration and licensing of PBMs. In our code, if you look at the auditing entity definition, it says that's a person, company that performs a pharmacy audit. So the pharmacy audit, in my experience, is a very small piece of what a PBM does. They do a lot of things. They process claims. They work with formularies. They collect and payment. They set networks. They make payments to pharmacies, negotiate those prices. They do a lot of different things. So auditing is a very small piece. So if you audit pharmacies, you be registered. But if you do what a PBM does, which is 99% of the other stuff, I think you need to be licensed. So I just wanted to make that distinction, that the registration is just not sufficient in my members' experience. And we have made some requests to different bodies, whether it's the AG or the OIC, and we've actually received cease and desist letters from PBMs. My members have, and they're really not comfortable going too much further after that. If you know what a cease and desist letter is, it basically says stop your conduct immediately under threat of litigation. So I've advised them to stop at that point, as I think any advocate would, and that's why we think this layer of regulation is necessary for this industry.
Thank you, Matt. Does anyone have questions for Matt? There's no questions. Thank you very much.
Thank you.